Good evening, guys. I have another bonus one for you. Tonight it's discussion E. This one discusses a single county, Crawford, for example, in Pennsylvania, how the budget cuts are going to affect Crawford as a whole for senior services. So here we go with the presentation I have for you. Okay, the proposed 2026 federal budget presents a consolation of structural and funding shifts that could reverberate across Crawford County's aging landscape, especially for rural or low income and historically underserved populations. Let's unpack the implications and explore how your systems level expertise could help mobilize a proactive community driven response. Aging services on the chopping block. 1. Nutrition programs, Meals on Wheels, congregate meals. Despite inflation and rising fuel costs, these programs are only level funded. In Crawford County, where transportation barriers already limit access, this could mean fewer delivery routes and reduced meal frequency, longer wait lists for isolated seniors, increased reliance on informal networks or food pantries, senior centers, and supportive services. Transferred to CMS and under the HHS recognition with no funding increase, these centers often serve as lifeline for social connection and mental health support, transportation coordination, and wellness checks. Culturally tailored programming for diverse older adults without dedicated aging focused oversight. These services risk deletion or misalignment with local needs. Family caregiver support programs, flat funded and shifted to CMS, potentially reducing access to respite care and caregiver training, mental health counseling, and peer support outreach to rural and marginalized caregivers including those caring for elders with dementia or complex trauma histories, health promotion, and disease prevention. Funding for fall prevention goes to CDSME and preventative health initiatives is estimated. In rural areas like Crawford, where clinical access is limited, this could increase ER visits and hospitalizations, undermine chronic disease management, and disproportionately affect older adults with mobility challenges or, or cognitive decline. Alzheimer's disease initiative remains 16.7 million, but loses supplemental support from the Prevention and Public Health Fund, PPHF. This threatens county-based dementia education and outreach, early detection efforts, and culturally adapted memory screenings. Integration with trauma-informed life review and intergenerational programming. Structural shifts with systematic consequences. Elimination of the Administration for Community Living. Aging and disability programs absorbed into CMS and ACF. Risks include loss of aging specific policy expertise, reduced community input, and participatory design. Fragmentation of services that were once coordinated under CACL's holistic umbrella. Impact on area agencies on aging. Crawford County's AAA may face increased administrative burdens navigating new federal structures, reduced flexibility to adapt programs for local cultural contexts, uncertainty around funding streams and reporting requirements, localized fallout in Crawford County. Given the county's aging demographics, infrastructure gaps, and rural isolation, the budget's ripple effects could manifest as social isolation and food insecurity, especially among elders without family nearby, or reliable transportation. Caregiver burnout. With fewer supports, informal caregivers may face emotional and financial strain, reduced access to culturally responsive services, particularly for African American elders, veterans, and LGBTQ seniors. Disruption of participatory models, including those you've co-designed to center community wisdom and lived experience. Co-creating a community response toolkit. This moment calls for strategic advocacy and local reliance, building on your participatory frameworks and myth-busting expertise we could develop. A stockholder map identifying key players across health, policy, and community sectors. A modular advocacy toolkit with customized policy briefs, talking points, and data visualizations. A myth-busting memo clarifying what's at stake and counter misinformation. Okay, evaluation of matrix to track impact and adapt interventions in real time. We could even prototype a culturally adapted life review model that doubles as a policy engagement tool, budgeting personal narratives with system change. Ready to sketch that out to draft together. Okay, guys, so that is E for you. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.